Hi, my name is Serena Gurfey. I am a master's student at ECPI University, and I will be presenting a PowerPoint presentation. PowerPoint presentation is on standardizing moderate sedation policy. The description of the project is to standardize a moderate sedation policy at Naval Medical Center, Portsmouth. The Bureau of Medicine and Surgery, known as BUMED, has taken proactive approach to standardizing the standard operating procedures, known as SOPs, throughout Navy medicine. This standardizing comes from the Defense Health Agency, which mandates that all policies and procedures be standardized throughout military medicine because most hospitals are tri-service, and tri-service means there's more than one service at that hospital, as in the Army, the Navy, the Air Force. Standardizing helps to reduce training needs, and to have the same policies across the service saves time and money. Standards are established for each state to protect the public safety and authorize the practice of the profession. Because of this, the requirements for licensure and advanced practice nurses vary widely. What is moderate sedation? So according to the American Society of Anesthesiologists, moderate sedation, also known as conscious sedation, and could also be known as procedural sedation, is a drug-induced depression of the consciousness during which patients respond purposefully to verbal commands, maintain their own airway and cardiac functions without interventions. Moderate sedation is becoming more and more in demand since procedures are moving away from the operating room and into doctors' offices because it is cost-effective, decreases the amount of admissions, and is time-effective for both the patient and the doctor. Why standardize this particular policy? A pharmacy technician discovered that departments were using way too much Narcan when reviewing meds in the Pyxis. Upon investigation, it was discovered that a few nurses were reversing the effects of the conscious sedation medicines during recovery. Narcan should be used in reversing adverse and life-threatening respiratory depression caused by the sedation medicines, not as a recovery agent. Also, the current policy for the pediatric intensive care unit was not up to date. They were not using the command policy. Actually, don't think they were using any policy. And their nurses that were acting as monitors during the sedation cases had not been to the moderate sedation training course that is mandated per the policy at NMCP. Commonly used meds is Versed, fentanyl, and ketamine. Nurses are not allowed to push IV propofol for moderate sedation because there is a higher risk for adverse reactions. Cases, and also they use propofol is mainly for deep sedation and not conscious sedation as well. Cases in the GI clinic use a combination of fentanyl and Versed. Combining the use of a benzodiazepine and an opiate may be preferable for longer procedures, but increases the risk of oxygen desaturation and cardiorespiratory complications. There are no reports of adverse reactions that have occurred in the GI clinic as to date. I just wanted to go back for one thing. For deep sedation, you have to have an anesthesiologist for it at NMCP. Who receives moderate sedation? There is no specific target population for the standardization process. Both adults and pediatric patients receive moderate sedation at NMCP. The most common procedures are endoscopies and colonoscopies through the GI clinic. And depending on the age, pediatric patients are more likely to receive ketamine over any other IV medicine for MRIs or bone settings. The nurse's role. The nurse acts as the monitor during the procedures. And the monitor must be an IV push medicine certified and have also completed the moderate sedation training course at NMCP and complete the adequate number of cases annually as well. So monitors are responsible for directly observing the patient during the procedures. This includes vital signs and assessments. This is a national standard. Even though the American Society for Gastrointestinal Endoscopy allows the monitors to perform tasks as well, I stress that the monitors at NMCP is only to directly observe the patient during the procedure. They are not allowed to act as assistants to the provider. Assistance can be given by a corpsman or another nurse.